So let me talk a little about what we call the conventional medical paradigm. So a paradigm is a system of ideas. It's what you believe in, and often these beliefs are very unfounded, but they are in society, and so we live with them. And in the conventional medical way of addressing illness, mind and body are very separate. If you have a mental thing, you go to a psychiatrist or a psychotherapist, or you see a psychologist. If you have a bodily thing, then you go and see an expert in physical illness. Because they're seen as separate, then surely physical illness must be due to physical causes. And therefore, physical illness has to be treated through physical means. And that's what you will find out when you go to the doctor. You know, if you've got something on your skin, you go to a dermatologist. If you've got something in your tummy, you go to a gastroenterologist, and so on. And by the way, the endocrinologist has got no crossing over with what the gastroenterologist is doing. So it's not really working that way. Now, the interesting part is that separation between the mind and the body has got no scientific basis whatsoever. And everybody knows this, by the way. Every doctor knows that your emotions affect your brain chemicals, your neurotransmitters, you know. So for example, when you reach a goal and you get an oomph, that's dopamine, yeah? As well as when you have serotonin imbalances, then you get depression. But actually, what if that serotonin imbalance was actually the manifestation of you being depressed? When your neurons communicate with each other and say, hey, we're sad today, it's the serotonin that goes out the window, yeah? Every doctor knows that emotions affect your hormonal balance, and a very classical example that everybody would understand is if you get scared, what do you release? Adrenaline, yeah? And if it's ongoing stress, cortisol. Everybody knows that stress affects your immunity. What do you get after you have exams in university? You get a cold. Everybody knows that it affects your cognitive function. So again, when you're stressed, you don't think straight, you're foggy brain. Your digestion, if you get anxiety, what goes first? Everybody knows it's the gut. Circulation as well, high blood pressure linked to stress situations as well. Our perception of pain, every congress this day that talks about pain and the management of chronic pain looks at, they're looking at it, they don't know what to do with it, the mental and social background of chronic pain. There isn't a biological real explanation for why pain has to keep on going after the injury has been resolved. That doesn't make any sense from a biological point of view, and yet you have these people for years carrying pain around. And so now, if you go to a physio conference, to a medical conference, they're all talking about the mental and social background of pain. And if you really want to get scared, Google telomeres. Now there is research. Telomeres are little caps at the end of your chromosomes, so that's what hides your genes away. And they know that the length of the telomeres is related to lifespan, how long you're going to live. And it turns out that people who say that they have been subject to chronic stress, they've got shorter telomeres. That means that they're going to live less. But everybody knows this. And what are we doing about it? Not much. So why? Because of that distinction between the mind and the body and the focus on laboratory and experimentation, we've been focusing on the mechanisms of disease as opposed to the cause of disease. What does that mean? For example, let's suppose that you're stressed. What happens to your gut? It goes. What happens after a while of your gut going? Guess what? The bacteria change. So now, even if you go to naturopathic conferences, everybody's talking about the gut flora and how it changes in people who are chronically stressed. And what are we doing? Oh, let's go and change the gut flora. So you're populating the gut flora with something else, but you know what they know now? There's a brilliant book out there if you want to sit down and read it, because it's quite medical. It's called The Mind-Gut Connection. And this gastroenterology has been, gastroenterologist has been, I don't know how many years, I think it's about 20, researching the gut and the gut flora and blah, blah. So they do try to change people's gut flora to reduce their experience of stress. But what they have realized is that they can change as much as they want. Within a few weeks, the gut flora goes back to where it was. So we're becoming experts at modifying how the disease is mechanically manifested. Okay, so for example, a depressed person, distorted level of serotonin, let's give you medication that changes your serotonin, but nobody's looking at why they got depressed in the first place. If you're anxious, let's play with your gut flora, but nobody's looking at why you got anxious in the first place, and so on. If you've got a headache, let's give you a painkiller. Nobody's looking why you had the headache, and so on and so on. And so we're becoming very, very good at handling the mechanism of the disease while nobody's actually looking at what's in the background. And you know what would happen eventually if you get rid of all the little symptoms? This is still going on. So you might get rid of the headache, but then you end up with a back pain. And then you get rid of the back pain, and then you end up with digestive disorders. And then you get rid of that, and then let's have a cancer instead. Because the background problem is not resolved. We're getting sicker and sicker. So the world is experiencing an epidemic of, I don't need to tell you this, it's in every newspaper. We've got basic diabetes, chronic pain, back pain, chronic fatigue, autoimmune conditions, allergies, fibromyalgia, cancer, and cardiovascular disease. And it seems like all these diseases have got they go in trends. So for example, right now it's like, oh my God, my consult is like full of fibromyalgia. I never heard of fibromyalgia 10 years ago, and now everyone's got fibromyalgia. Is it because it's more diagnosed? Or is it because it's just we've run out of the other stuff? I'll give you an example of how we ran out of the other stuff. Back when I was 21, I had 4 peptic ulcers. Now, then, 15 years later, they discovered Helicobacter pylori, and they started giving antibiotics to kill the bacteria that supposedly was causing the peptic ulcers. Great, we don't have peptic ulcers anymore. What do we have now? SIBO. So SIBO is a syndrome of intestinal bacterial overgrowth, which is a lot worse than peptic ulcers. A lot worse. It's a lot more complicated. So the question and the reason why you're here today is what is possible when you combine the two? What if you could have a form of medicine that looks at those things? So I'm going to introduce you to the work of this gentleman here, Dr. John Sarno, who died last year at the young age of 94. Who was quite a peculiar man. He was the director of the Rusk Institute of Rehabilitation Medicine, which is in New York, and he was a professor at New York University of rehabilitation. So he ran a department of rehabilitation medicine. He wrote 4 books, and if you're suffering from any kind of pain or any of the things that I put in the blurb for this talk, which was fibromyalgia, chronic pain, migraines, anything that is chronic ongoing pain and burdens, I recommend those books. I read this one first, Healing Back Pain, and it was a good introduction, but recently I finished The Divided Mind. If you really want to go into detail, go there, okay? And in the Divided Mind as well, you've got a few chapters. Yeah, for sure, yeah, take photos too, I really need. In The Divided Mind, you also have a few chapters written by other doctors, including an orthopedic, I'll tell you that later, why it's so funny. There's an orthopedic surgeon saying, I'm writing this chapter, and I don't know what to do with my career, basically. So the interesting thing about Dr. Sarno is that he became the director of this department, and you can imagine in a rehabilitation center, you see a lot of back pain, mainly in the United States, and then all sorts of chronic pain. And he realized that a lot of his patients had history of having migraines and things like hay fever peptic ulcers, so things that were known at the time to be psychosomatic. So there were certain diseases already in the 1960s, 70s, 80s that were considered to be psychosomatic, so a huge influence of the mind. And he started practicing in 1950, by the way. And he practiced for a good, I think it was 65 years. And so he asked himself, what if this chronic back pain that doesn't go away was also psychosomatic? Because quite frankly, they were not getting the results that they wanted, even though these people were following programs for rehabilitation and so on. He also noticed that very frequently people had changes in their MRIs or in their x-rays that didn't link with the symptoms. Like, for example, the pain was in a location where it shouldn't be. Or that they could be people with changes in the MRI and no symptoms in that area. A lot of normal people had changes in the MRI. So it didn't quite match the neurological examination of what he was saying in the MRIs. So that sort of confirmed for him the idea that this could be possibly psychosomatic. And so he created this theory that in the medical establishment is not accepted, so it was quite revolutionary, which he called the tension myositis syndrome. So what did it consist of? In his theory, you had some form of emotion, negative typically, that would constrict the muscle in an area. Because the muscles were constricted, then there would be less blood flow to that area, reduced circulation, and because of that, there would be some, well, first lack of oxygen, and second, you're not clearing the toxic substances that you have to clear, which led to muscle inflammation. And because there was inflammation, then that would lead you to move less that part, and therefore there was even less blood flow, and the whole thing became a vicious circle. Okay, so it all started with a muscle contraction, and because you're removing less and you're scared of moving because it's going to hurt, then it gets worse and worse and worse and worse. Now, what's at the origin of that muscle tension? He proposed that it was unconscious emotions. Now, this is a little bit complicated, because if it's unconscious, how do you know that you have them, right? By definition, something that is unconscious is something that you're not aware of. So, according to him, and this is how he explained it, he said that everyone has some negative emotions. We have to have negative emotions, which we don't want to accept. Okay, so what do? We shove them, we repress them, and we forget them. Okay. And that was particularly the case in people who had these personality traits of being the good ones or the perfect ones. So an example of the good one would be the mother of three who's trying to be the best mother on earth, and she would never allow herself to accept that she wants to kill the little monsters every so often, right? So and I've seen a lot of people like that actually, you know, oh no, they're my life, and what, did you get tired? No, I just love them, and she's like this with migraine. So the good one who cannot accept those negative feelings, and the other one is the perfect one. So the perfect one doesn't have a day of rest. The perfect one is never tired. The perfect one will never accept that I say she because it's, I don't know, 80% of my practice is women. But that's the nature. Women go to healthcare and men don't. They just hold it on. And so in those two groups, he saw that this was more prevalent. And so in his theory, what the symptom was doing was providing a distraction so that the person wouldn't look at the emotions. Okay? Now, this is the part I don't agree with, but that was his theory. He said, okay, as if you have a symptom, then that gives you a distraction, so you don't have to look at the emotions. And so for him, the symptom was a protection. Okay? Now, in his view, well, everyone has got negative emotions, therefore we all have to have psychosomatic symptoms, and I totally agree with it. I challenge you to find someone who doesn't have at least one symptom at any given time. Okay, but that's my theory. Okay, so in his theory, if that person recognized that they had unconscious negative emotions, then that would be enough for the symptom to go away, because then it wasn't necessary. If it was trying to hide something away and you discover that it's there, then the symptom can go. Now, this is his treatment plan. It gets very interesting. The first thing he would do was have a screening-informed conversation. Basically, in that conversation, he wanted to introduce the idea that this illness could be psychosomatic and see how the person would respond. If the person responded, no way, I've got a herniated disc, L4, L5, and it's physical, and then he would not include him in his program. He would just send them to normal rehab. Okay? That's it. If they were open to considering the possibility that this was a possible psychosomatic condition, then he would take them in, and he would spend a good hour going through the whole story of this person, their illnesses, allergies, blah, 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 and then do a thorough examination, checking, where the pain was and so on. And in his records, he had, I think it was 18 points where he described that people were more sore, if it was, especially with back pain. after that 1 hour and something, he would look at the patient and say, you have TMS. So basically, this professor from New York University tells you that your syndrome is tension myositis syndrome. It's coming from your emotions. Of course, people would see him as this professor, would believe it completely. And then the next step was to take them to a 4-hour lecture, and the 4-hour lecture consisted in explaining the whole tension myoneural syndrome, step by step, and how it happened, and what does oxygen do, why does it hurt, blah, blah, blah. At the end of those 4 hours, I presume that people came out really convinced that actually it makes sense that I have tension myositis syndrome. Then they would send them off with the assignment of every day for 15 minutes, sit down and journal, because in his theory, again, all these emotions are unconscious, so they're not even aware of them. They would journal what could possibly be in their lives causing negative emotions. Causing negative emotions. So it would be like, look at your childhood and start writing an essay as long and as detailed as you can about what could possibly have caused you to experience negative emotions today. So you would spend 15 minutes every day elaborating on that, and then if you finish your whole childhood, you look at any other past experience, and after you finish that, you look at your current life and what's stressful and how it could possibly be impacting your negative emotions, whether you were needing to be good or perfect at any given time. And the other thing that he saw as a very common pattern of being stressed is the possibility of death or aging, so losing capacities. So people would do that for a month. And after, oh, hold on, this is the best part. He told them to stop any form of physical treatment. Because what he realized is that if they continued doing the physical treatment, they would still mentally be looking for a physical cause to their back pain. And so it would be so that the work about digging into emotions would be left to the side. And so I cannot even imagine how that went down in a hospital for rehabilitation, but he managed to pull it off. So basically that group of people were recommended to not do any physical therapy, to go back to doing sports and moving normally. Okay? And at 1 month he would call them up and see how they were doing. Now what results did he have? 1982, I told you the information is quite old, but 177 randomly chosen patients from all of his client base were selected from the previous three years, okay? And 76% said that they were having a normal life and they were effectively pain-free. Now, you know what the interesting part is? That those patients, the average time they had chronic pain for was 9 years. 9 years of chronic back pain. They do that, and 76% declare that they're basically back to normal after this 1 month of journaling. They then, that same population, in 1987, they reviewed that population, but they looked at those who had evidence in the CT scans that they did have physical abnormalities, right? And they checked those people. And of those, 88% stated they were pain-free. And those are the ones who had the changes in the CT scans. So the doctors probably didn't ever believe that this was possible, but if you Google Dr. Sarno, you'll find testimonial after testimonial after testimonial. He saved my life, you changed my life, you're a saint. There was an interview, he would have been the equivalent to Oprah back in the days, but he was like, oh my God, I just adore him, he's a saint. What does your wife say about, are you a saint? What is it like sleeping with a saint? It was like, listen to the interview and think, wow.
Are you married?
So what were Dr. Sarno's challenges? His biggest challenge, and he writes it in the books, is that only 10 to 20% of people were willing to accept that their condition could possibly be psychosomatic. In those phone calls, only about 1 in 9 he could accept into the program. Because all of the other ones were still looking for the physical reason why they were in pain. And that was the biggest challenge, that limiting factor. And another interesting thing was what I was talking about before, the symptom imperative. You know, if you've got negative emotions and you go and treat it, let's say that you have an operation and it works well, in his theory, if you still have that negative emotion, then you have to come up with another symptom so that you've got a distraction from that negative emotion. And that's actually not unusual. Remember about 2 years ago, a lady came to see me with, I think she came for insomnia, that was the thing. She came in literally with 4 pages in font 9 of everything that she had. And it was surgery after surgery after surgery after illness, everything that had gone wrong. And seriously, I mean, you have to have bad luck, but this was like shoulder operation, hip operation. And this woman was like, crippled, angry person. It was unbelievable. So that was his warning. Be careful, because you can solve something at that level of physicality, but then if you're not solving the emotion behind it, you end up with something else. Now, I think this is a very impressive record, and I have a little variation as to how I see the mind-body phenomenon. So again, I've been in this for probably 13 years, but then a big influence in the way I look at my body is through Dr. Brian Broom, who's a New Zealand doctor, and he's an immunologist, and he also trains as a psychotherapist, so he had training in both worlds, medicine and psychotherapy. And he was the leader of the AUT program in mind-body medicine, so I completed that there. And we sort of agreed in that form of thinking, illness was symbolic, okay? And it's a symbolic expression of what's going on for you emotionally and mentally, so even beliefs can be expressed symbolically. So, imagine that I imagine my life. Sorry, I was going to pull out the whiteboard. Where am I going to put it? And if in my story that I tell myself is that my parents never loved me, okay? Heart. Broken heart. So that's my story, and I carry, my parents never loved me. Then symbolically, your body could be doing, okay? And that's your backache. And then you go and have an operation and get rid of the backache. So my black marker is gone now. Well, now I have a green marker. Okay, and that's your SIBO there. And then you go to the gastroenterologist and you do all sorts of maneuvers and you change your gut flora, and that happens to be successful. And you're like, oh my God, I live with a rat now. Symbolically, what am I going to do? Oh, I know. That's it. My parents never loved me, you know? So the body is a little bit like that. If you are angry, then it manifests angry conditions. If you're sad, then you start developing sad stuff. But I've seen exquisite levels of how symbolic the body can get. It's unbelievable. I have some funny stories about that. So your story is what you tell yourself about your life experience. So, for example, somebody who says, my parents never loved me, could be very angry or they could be very sad. Depends on the tone that they give to the story. And the story seems to be central to that, what happens in that person. And that person has got like multiple facets. So that if you look at the person this way, you see the body. If you look at the person this way, you hear their language. If you look at them this way, you see their emotions. And they're all sort of coherent. So if your story is my parents never loved me and you're sad, then there's something about physicality that's going to look sad. You look at them and they've got their faces dropping. Eventually they start doing less and less exercise, they gain weight. There's something about the look that is about sadness. If you hear them talk in the tone of voice is like this, and you talk about sad things. And if you could have a microscope into their thoughts, then they would be thinking sad thoughts. So the whole thing is coherent around how they have interpreted their life events. And typically it all starts with an interpretation when you were like 3 or 4, but then you carry it on. So look at this guy, for example. He must have some story in the background. I don't know what it is. You can fantasize about it. But it's probably not a very happy one. And so if you were to think what he's thinking, what is he thinking? Life sucks? I hate everyone? I don't know, whatever you can imagine. His feelings are probably linked to anger, resentment, things like that. Behaviors, what do you think he's like at work? His relationships, love to go out with him. Spirituality, I'm not sure what he would think about spirituality. Does he have a connection with the universe? Does he have any sense of gratitude? And if you were to look at that physical body, that's a typical back pain man. Okay? That's a typical worker who has a little injury and never recovers, and then spends 6 or 7 years or 8 years on ACC. But it's not the little injury that caused it, it's that. So again, it's that idea that the mechanism is not the same as the actual illness. Of course, you're going to see physical and chemicals changes. If you go and measure the gut flora of somebody who's anxious, you'll see that the gut flora is abnormal, but that's not the origin of the problem. Okay? And of course, people who are intolerant to everything, what do you think they're going to have?
Food intolerance.
Food intolerances, of course. You know, and I know straight away when somebody books and they say, oh, I've got the food intolerances. Okay, here we go. There is a very distinct black and white as to what is acceptable and not acceptable. Typically, a lot of them are perfectionists. You know, it's I'm good if I do this and this and this and this, but I'm not good if I do that. Or they're so angry that they only accept people like this. Have you heard that expression with people, oh no, I love mingling with like-minded people? Intolerance! It's like, I can only hang out with people who think just like me. Okay? So, and I see it in the clinic all the time, it's such an obvious pattern. Mental intolerance links to food intolerances. So, I'm just going to give you a few examples of how that has worked in my practice. This is actually not me, but it's my story. It's one of my stories that occurred to me. So before I embarked on all of this, and this is back in the times when I was doing my diploma in cinematography, I woke up one Saturday morning with a severe swelling of my face and my hands. So my whole face was swollen. I could barely open my eyelids, and my hands were pretty much like that. So I took myself to a hospital in Paris who had a dermatology department, seeing anyone on a Saturday, which is unheard of. So I did 3 or 4 hospitals because, of course, I had already run through the list of what it possibly could be as a GP. You know, sort of like, is it cosmetics? Is it photosensitivity? Is it? So after a few rounds, I ended up with like 7 dermatologists around me taking pictures because it was so bad and such onset, such quick onset. And in the conversation, they were all talking, and of course, one of the possibilities was lupus. This rash looks very similar to the rash in lupus. Another possibility was photosensitivity. It was the winter, and those were the areas of me that were exposed to the sun. And another possibility was a cosmetic that I had just put on my face and my hands. I was given steroids and antihistamines, sent home, and I had the worst night ever because I couldn't sleep due to the itching. The next day was the same thing. Went back to a follow-up. 2 days later, nothing had changed. They upped the dose of steroids, upped the dose of antihistamines. Surely that would do it. Another day of misery. Basically 4 nights of no sleep. And then on the 5th day, I sat down and asked myself, what does this mean? And back then, I didn't used to think this way. It was just a moment of inspiration. And at that moment, I realized that I had been living in Paris for 9 months, and I didn't have a single friend. The only areas of me that could be seen by anyone were my face and my hands, because it was wintertime, and that ever since I developed that symptom, people were opening the door for me, and in the subway, they would give me their seat. I mean, how good was that? I looked like a monster and people were being nice to me, and I realized my body is just raising red flags saying, look at me, hello people. I realized that, and basically the next day the rash went down big time, and by 36 hours pretty much it was gone. Now interestingly, for another year, every time that I would get stressed, my face would tingle here. And I was like, oh my God, I'm going to cause myself a lupus, which is a terrible disease. And I ran into the one and only person at the time, this is like 20 years ago, who I knew knew something about MindBody. And I said, I'm very concerned that I'm going to cause myself a lupus. And she looked at me and she said, oh, Marilla, if you can cause yourself a lupus, why don't you just uncause it? Well, I don't know what I did to my mind, but I never had the tingling again. I never had that. So this is just an example of how symbolic that was. Here I was crying for attention, crying for connection, and I managed to develop the red flags that got me that attention and that connection. So in my world, there are events in life. Everybody has events. Everyone has somebody who dies, or they're not loved enough, or whatever. And we attribute a meaning to those events, and that's what I call the story. Depending on the story that you adopt, you have certain feelings. And those feelings then determine what symptoms you're going to show. And so with that information, how can you transform your story and therefore let go of the symptoms? How would you like to, if you're living with feelings that are negative all the time, or situations that you see as being difficult and harsh, how can you change them? Well, one option is the obvious. You change what you're doing. If you're in a marriage that is driving you insane, then sometimes you have to split. Okay? Of course, you have to look at why it's driving you insane. It might be a pattern that you've been repeating for the last 25 years. If you're working 16 hours a day for a company that you have got no interest in, well, obviously it's not the right place for you to be. Okay? So there's things that you can change in your life. But the problem is that as long as you're dealing with a physical illness only at a physical level, you never look at this seriously. If you keep going, I've got a tummy ache, I've got a tummy ache, I've got a tummy ache, let me go to a naturopath, let me go to a herbalist, let me go to the osteopath, let me go to the gastroenterologist, and in the meanwhile you're working 16 hours a day, and that problem is never going to be resolved. Some of us suffer not because of what's happening now, but because of what happened a long time ago. Okay? In which case, you look at your life events and you suffer when you look at your past life events. So what can you do about those life events that occur in the past? You change the meaning of them. And so reality, anyone's reality, at any given time, it's like the yin and the yang. Everyone's. No matter how beautiful the life looks in Facebook, I can assure you that there's a dark spot in there somewhere. Okay? And no matter how difficult and harsh and horrible the life is, I'm sure that there's a light spot there as well. Okay? So everyone has got a possibility to look at the darkness or to look at the light. And that's a choice. We think that we don't have a choice. We think that because we were battered as children, therefore we have to be obsessed with that pain the rest of our lives. Actually, no. If you wanted to, you could turn around the meaning of that experience and realize how resilient and how strong and how brave and how courageous you came out of that experience. And really breathe those feelings, really reprogram your brain so that when you wake up in the morning, you feel resilient and strong and brave because you survived that stuff. Yeah? So, once you start accepting this, that there is no ideal life, everyone's life has got a yin and a yang, everyone. And again, I challenge you to find somebody who doesn't have a symptom. Does anybody in the room not have a symptom? At least one. Okay, everyone at any given time has to have a symptom. Why? Because we all have the yin somewhere. There's always something in our lives that we're working on. And if we weren't working on something, we would be dead. And guess what? Let me explain you my theory of growth. I think the purpose of life is to grow. So we start off like this. And as we grow as people through different challenges, we start expanding our comfort zone. So our comfort zone becomes bigger and bigger. And the things that you couldn't do when you were 3 years old, like going to the dairy and buying a chocolate bar, well, you can do when you're 7. And then it becomes so obvious that you don't even think about it anymore. And then when you're 15, you've got another challenge, and maybe it's about going out on a date. And then once you do that, you're like, oh, that's easy, next one, right? And you keep expanding and learning lessons. Now, there's two ways to grow, because of course the comfort zone is fantastic. Isn't it comfortable? That's why it's a comfort zone. So there's two ways to grow. One of them is to find something that is out there. That's called a dream. I work in this company and I hate it. I wish I could set up my own thing. Of course, in order to get there, you have to really fly over your comfort zone, don't you? Okay, so that's a dream. And life really wants you to expand and get there. Now, if we get too in love with our comfort zone, we never go for the dream. But life really wants you to go for a dream. So what do you think it's going to do? It's going to throw you a problem that makes your life so horrible that you have to go and get out of there. Jump out of that circle of comfort. And often these pains and aches are that opportunity to drop the stuff that is hindering you so that you can jump into the next layer, so that you can grow as people. Right. So those are the two ways in which you can change the story. Now, practically, how can you change what you're doing currently? You know, it could be that you see your... Okay, let me get you to think about something. What is the first thought that you have in the morning? Any volunteers?
To make lunches.
Okay, here we go. Oh, what have I got to do today?
What time is it?
I remember World Cup, I think it was 2011. I was in a pub, you know, and there were the Welsh people. It was a semi-final. And this guy was sort of like standing by me, and he was like, you know what I think every morning as soon as I get up is, how much sex am I going to have today? And I look at him. And I went, really? My first thought is, what am I going to cook for dinner?
Not a good match.
That was so funny. Anyway, so people wake up in the morning thinking, you know, what have I got to do today? And you start listening to people's first question in the morning, and it's fascinating. I've got people who ask themselves, what have I got to do to survive today? So what is that quality of their life going to be like? What if you started your morning with this? Close your eyes right now. Take a deep breath in and out. And bring into mind right now something that you truly can be grateful for. Something in your life that is magnificent, that just for that thing, it is a great thing to be alive. Now bring in that thing into your mind and see it. See it with details, with colors, in technicolor. You see the lights and the shadows, you can see the shapes. You can listen to the sounds that that thing makes. If it is a voice, listen to the tone, listen to the volume. Imagine smelling that thing. Imagine touching it. What is the texture like? What does it feel like? What is the temperature of that thing? Taste it if you can. It might be something you can taste. And then find that place in your body where you can truly feel happy, grateful, ecstatic about this thing in your life. Find that place in your body. And then invite that feeling to grow bigger and bigger and bigger until the whole of your body is full of joy, is full of life, is full of energy. You're like, wow, I've got this present in my life. How amazing is this? And now, for a moment, just notice how you're breathing and how your body feels. What is it like? Is it calm? Is it relaxed? Is it comfortable? Now you've just done 1 minute of this. Imagine you did this for 5 minutes, just contemplating this thing that already exists in your life. And then gently let it go and bring a second one and do another 5 minutes of that. And then bring a third one and you do 5 minutes of that. That would mean that you would wake up every morning and have 15 minutes of gratitude. And gratitude is, you don't need anything for gratitude because it's based on stuff that you already have. It's just that we don't have the time to observe those things so we can truly enjoy them. Gratitude is the art of enjoying what we already have. And when you start your day doing this, it already sets the tone of the rest of your day. And surely you're going to have challenges because, again, reality is a yin and a yang. So we're always going to have the yin, which is your edge there, that invites you to growth. But you're already starting your day with a good feeling. And then any feelings of the past can be changing meaning, even the most atrocious ones. Okay? Even sexual abuse, even terrible things can be changed. So I'm going to play you a little video. This is interesting. I hope you can hear, actually. Hold on.
I'm obviously very active. I'm aware that injuries happen in the world of sport. And I've never come across anything that I'm going to tell you in the way of rehabilitation that's I've ever experienced. And that's on my heart. I was injured in Andorra in Europe in a run, halfway through an ultramarathon. I banged my knee on a rock and the collateral ligament swelled up on the outside of your knee. And I had rehabilitation, physiotherapy, osteopaths, but just nothing was working. And I was back in Raglan after coming back from Europe, and I bumped into Morella on the beach.
How long did you have the pain for?
So it would have been,
5 months, probably.
so probably about 5, yeah, I think that would be realistic to say. And then Morella and I chatted on the beach, and obviously I know Morella is a doctor. I was like, yeah, look at my knee, no one can sort it out. And so I tell her that it's swollen, and the first thing Morella actually said to me, Tom, it doesn't look any different. And I was kind of like, yes it does, look at the other knee, yes it does. And I was convinced in my own mind that it looked different. And then, when we were pointed to sit down, I was like, and then during my course of walking the dogs along the beach, it was painful, I'll admit to that, and I was kind of like, yeah. And Morella said to me, Tom, it's an emotional thing. It's all about, you've got this, you've come back from overseas, something's rejigged, and you've got to move forward. The knee is about moving forward. And when that was said, Morella said that to me, and in my mind, I was kind of like, something clicked. I couldn't tell you whether it was subconsciously or consciously, but I was very proactive in thinking about that. And so when we left the walk, I was like, right, I've got to move forward. And the moving forward for me was actually letting go of things that had happened to me in the past and letting go of actually one thing in particular, my house. And it's happening as we speak, actually. It's taken a long process, but that's by the by. But once I did that in my head, I woke up, and I had a long night because I was very restless and thinking about these things. The next morning I woke up and there was no pain. And it was quite extraordinary. I was kind of like a little bit freaked out initially. I was like, oh, this is a bit strange, because I've had pain for so long. And then there was no pain, but I realised that I'd let go up here. It wasn't the physical thing in the house, but I'd actually let go in my head. I'd gone, it's time to let go, it's time to move forward. And that, for me, was very powerful.
This was like walking the dogs for 10 minutes together. And that's all I said. Oh, knees are about moving forward. How do you go forward in life? And seriously, I mean, I'm not standardizing, every knee has to be that, but you know what, in my experience, 8 out of 10 cases, It's typically about moving forward, letting go of something, how to move forward. I'll give you another example. Hashimoto. So I mentioned that one of my illnesses that I had in my 20s was Hashimoto's. Does anybody know where it is? Heard of it? Okay. Basically, it's an autoimmune condition. So you've got your immune system attacking your own thyroid to the point where the thyroid doesn't work anymore. So your thyroid hormone levels drop. Okay. And because of that, then your thyroid hormone, so it's like your hormone that you need for metabolism. Everything becomes slower, so you gain weight, you lose hair, you're slower, you have a foggy brain, you're tired. Yeah, basically it's like that, except she looks a little bit rounder, but she gained weight. It's a very uncomfortable condition to have, and according to medicine, it's not curable. Once you have Hashimoto's, it's an ongoing process, you don't go back. And because the problem is that you've got low thyroid hormone levels, then the treatment is to give you thyroid hormone as a replacement, and that's it. Some people respond well to that, and they live the rest of their life just taking thyroxine. But some people never get rid of the symptoms of the brain fog and the fatigue and so on, so even though they're taking the hormone. Now, I was in that case. I remember taking thyroid hormone, didn't make any difference at all. Now, just going through the autoimmune process is your immune system attacking your own thyroid. Okay? Now, back in the day when that was happening for me, I identified a number of themes of what had happened. Which then I decided, after seeing a number of Hashimoto's people in my practice, that the themes were basically, I think I can summarize them in 3. The first theme is, if your thyroid symbolically is the butterfly of the body, what do you think that symbolizes?
Transformation.
It's transformation. It's about flying free. It's about self-expression. It's about being yourself. And then when this was happening, I was very constrained in the world of medicine, and on top of that, I grew up in a South American household with a father who was extremely domineering. So I was like, and it's when I went to France and I did something completely different that broke the pattern. So again, the butterfly is all about that transformation, about becoming that butterfly. What is it that you really want to do? How is it you want to express yourself, and so on. And funnily enough, when the thyroid goes into full-on Hashimoto's, at the end of the process, it looks like, those shriveled and dry chrysalis that never developed into a butterfly. That's what a thyroid looks like when it doesn't happen. So that was one theme, the lack of self-expression. The second one is that it's the powerhouse of your body. So it's how you create energy for your metabolism. So if you're going overtime all the time without ever resting, it's this super driven people who work 16 hours a day every day, or they've got 4 children and they're running around all the time, they're completely exhausted. So it's got to do with that theme as well. And the third theme is the autoimmune thing. Why would your body attack you? If you look at it from a mind-body point of view, why would your immune system, which is supposed to be protecting you, attacking you? Well, there's 2 options really. One is you don't love yourself very much and you have to attack yourself. The other is you carry the genes of your parents, and there's probably a grudge there against one of them at least. So when that I put all these together and I was like, okay, I'm seeing the same patterns over and over again. And so I decided to create a program for Hashimoto's people. And so I ran a pilot program this year where we got a group of people who had Hashimoto's. And I wanted to test them to see if I was hallucinating or if this was real, right? And so I took them through a 3-day program and basically working through these themes, self-expression, self-love, getting rid of grudges against the parents, and basically how crazy hours are you working without respite. And it was a 3-day weekend. And what I did was pre-test them, so asked them to have their lab test from the doctors before the 3-day weekend, and then we got together 6 months later and we completed questionnaires and had them post-tested. Now, because it's a condition that can be medicated, only 2 people in the group had abnormal, so low levels of thyroid hormone, but were not on medication. There was a number of them who were on medication, so those tests afterwards don't count because whatever you measure is going to be due to the medication they're taking. And there were a number of them that even though they had antibodies against the thyroid, their levels of thyroid were not affected. Now the interesting thing was, those 2 participants who had high TSH, that indicates that the thyroid is not working, had come back to normal levels. So those who were not medicated ever, they went back into normal levels of thyroid after 6 months later. And in the questionnaire, 6 months later, 70% said general health was better, their energy levels were better, 60% mental clarity, focus and mood, 70%, social satisfaction, 80%, and improvement of any other symptoms, 40%. So basically those 4 days were about looking at their lives and how does the Hashimoto fit in the whole picture. And you know what the beauty is? These 2 people whose levels improved massively, one of them back in March was thinking about setting up a business, and she was terrified. She was in self-doubt. She didn't know where to start, and blah, blah, blah. And then when her results came back and they had normalized, I actually have to interview her because I have to go in. Well, she would wake up every morning and do her gratitude ritual, and then she would visualize what she was going to do for the day. And then she went and basically she did it all, and right now she's about to launch her business. This is 6 months later. She's feeling fantastic. She's got another health condition that is also improving. And the other one who normalized had a big issue with expressing her needs. And what had happened, because of, it's one of these people who doesn't want to offend anyone, she doesn't want to cause conflict and so on. And then when I asked her, what happened over these 6 months, and she's like, oh my God, I'm having arguments with everybody. Well, of course that wasn't going to go down well, but she became a lot more verbal. She started manifesting what she wanted, expressing with partner, mother, everyone that was involved. And again, her TSH normalized. So, in summary, what is the summary of the night? Why you're not healing? Well, because you're just looking at one aspect, probably. And I'm not meaning to say, like Dr. Sano, stop all physical therapy, because I know for a lot of people that would be catastrophic. Not only because you need sometimes to have medication and so on, but quite frankly, I did the experiment. I had pneumonia about 8 years ago, and I decided that I would go through it without medication. I coughed like a sick dog for a month and a half. I did sort out the underlying issue with what's grief, but I wouldn't recommend the experience. So, yes, do the physical stuff, but do it considering that it's the background of your life that needs to be sorted out. It's your emotions, it's how you experience in life. If there are things that you need to change, then work on that simultaneously. And this has to be like what you do in the meantime. So for example, let's go back to the theme of the food intolerances. Stop those foods that you're intolerant to because it will make you feel better, but then start contemplating in your mind, what are you intolerant to? Are you intolerant towards certain people? Is it certain personality traits? Is it people that you don't tolerate? Is it your marriage that you're not tolerating somebody in particular? So be aware that unless you look at the whole of your life, even if you solve the current problems, something else is going to appear. So I think my message of the night is go global. There's certain therapies that are very good at doing that. An example would be some branches of osteopathy are very mind-body. You release certain areas and then that causes a change in emotion as well. A chiropractic has got some branches as well, like that. Acupuncture can be like that, Ayurveda can be like that. But it's all about self-examination. How is this an invitation for growth? How is illness an invitation for growth? And every time that I get a new symptom, I ask myself, what does it mean? And how is this an invitation for growth? And another thing is that sometimes illness is the only thing your subconscious mind can come up with. Because it has tried everything, but you're not listening. Okay? So for example, I'll give you an example. A woman that was my client years ago, she had set up a business and she had used the family's money. Now, she hated the business, she hated the two business partners, it was not going well. Like, literally, she had to drag herself to go to work every day. You know what happened eventually? Because she felt that she couldn't sell the business, she couldn't let go of it, she developed MS. Which of course then permitted her not to go to work. So everything else she wasn't paying attention to, or she thought she couldn't do it, and therefore she ended up with MS. So how can you heal? Well, use the physical treatments if you can, or if you need to, if it's unbearable, but be aware that there's wider areas of your life that need attention. Change what is not working in your life, and go back and rewrite your story. So whatever memories you have of the past that are not working for you, just go and change the meaning. That can be done with hypnotherapy easily, and with any form of, well, actually hypnotherapy. I think that's as far as it goes. Because you really have to reprogram your brain to re-feel different in a different manner the experiences that happened in the past. Illness is your opportunity to grow, so go and grab it. Don't be scared of illness. It's a good thing. It's an invitation for you to change certain things. How are you going to do that? Well, I'm just hoping that you're a little bit more aware now of where it's heading. And listen to your body. Listen to your feelings. They're telling you stuff. Explore. Ask yourself stuff. Now, if you're completely lost and you don't know where to go, I'm going to run another one of those weekends at the end of November. So it's Friday, Saturday, Sunday. Friday, Saturday, Sunday. With that idea of going into, I mean, if you go to my website, you find a whole description of it, but basically understanding why you think and you feel the way in which you do, what keeps you thinking in the same way, what drives those emotions and thoughts, how you can change them, how you can reprogram your brain and your mind, how you can shift something in your consciousness that your relationships work better. How does your particular condition link to your mind and your emotions? So looking at the symbology case by case. We're going to break it down. There's actually clues, you know, where when I have clients with health conditions, there's certain things that tell me what is behind it. What is it a symbol for? And what I really like about a group is that when you have a group together, they sort of act as mirrors of each other. Because it's really hard to see yourself. It's really hard. But when you see somebody doing insane things that you connect with, you're like, oh my God, I'm doing the same thing. And therefore you recognize yourself, and that's when the penny drops. And sometimes these changes are instantaneous, things that you've been believing for your whole life, and suddenly the penny drops and it's like, oh! It is like that. It is. We have it every time there's somebody who goes, oh my God. The other thing with sharing with a group is that, again, you know that yin and the yang? We're all hiding our yin. We're all hiding our darkness. But what if the darkness was there to connect us? Because it's only when you admit that you've got that dark side that you can truly connect with other people. And that you can only achieve in a group. So I see people individually, but there's something about the group that is quite magical, because it's such a deep level of connection with other human beings, and understand that we're all in this journey, that we all have the same challenges. There is a commonality that happens in a group that is extremely beautiful. And yeah, we're all here to learn and grow and expand.